The primary underlying cause of plagiocephaly is torticollis. Torticollis refers to a neck muscle condition or imbalance that primarily affects a muscle called your sternocleidomastoid or SEM. Your SEM muscle comes from behind your ear and comes all the way down the front of your neck, attaching at the edge of your collarbone or clavicle. If you picture this muscle as a rubber band or an elastic, as that elastic or muscle tightens, these 2 points come closer together. And as they do so, it's going to make my head tilt in one direction, but actually turn in the opposite direction. Many of you maybe have noticed this in your babies, that they have a tendency to keep their head in this position or perhaps in this position, particularly when they are in the car seat or swing or vibrating chair when they are trying to hold their head up against gravity at a very young age. In this graphic, we see a tight left SCM muscle causing this baby to tilt to their left and turn to their right. In this graphic, we can see a tight right SCM muscle causing a tilt to the baby's right and a chin turn to the left. These next photos show us just how difficult it is for your baby to hold their head in a neutral position against gravity when in a seated device such as a car seat, vibrating chair, or swing. Because it is so difficult, seeing your baby tilt to one side in their seat does not necessarily mean that they have torticollis. However, if you notice they're always tilting to the same side, or you see that tilt and turn position at other times, it is definitely worth seeking out an assessment. If desired, there are head positioners available to help your baby maintain a more neutral head position, preventing that tilt and turn when they are awake and supervised in a seated device. With torticollis, the side that is affected is actually generally opposite to the side that they prefer to turn towards. So if your baby prefers to look to the left, it is normally the muscle on the right that is tight. If they prefer to look to their right, it is generally the muscle on the left. Now, aside from muscle tightness, what happens is with that constant positioning in that tilt and turn, the opposite SCM muscle ends up getting weaker and atrophies or actually loses some of its size and strength. With this baby, we see a tilt to the left and a turn to the right, indicating left SCM tightness or torticollis. With this baby, we see that tilt to their right and turn to their left, indicating right SCM tightness or torticollis. Here is another example of left torticollis with a left tilt and chin turn to the right. And here another example of right-sided torticollis with the tilt to the right and the chin turn to the left. We can also see the tilt and turn in older babies that are able to sit up. Here we see clearly that tilt to the left and turn to the right. With this little one, again, we see a tilt to the left and a chin turn to the right. In this slightly older baby, we see a right-sided head tilt and a left chin turn. And again here, a right-sided tilt and left chin turn, indicating a right torticollis. Recent research has emphasized just how important that early intervention for torticollis is. In infants where torticollis is identified and treated in that first month of age, 99% will achieve full range of motion within 1.5 months of treatment. If treatment is delayed until that baby is between 1 and 3 months of age, average treatment duration jumps to 6 months. If treatment is initiated between 3 and 6 months of age, treatment duration then jumps to 7 months with less favorable improvement in range of motion and strength. Given this information, it is super important that we try and identify and treat torticollis as soon as possible. In this newborn, you can see how tightly that left cheek is held against the left shoulder, likely as a result of in utero compression. Really look at your baby if they are positioned in a seated device, and if you notice a consistent tilt or turn to the same side, see if you can turn them and position them in the other direction. If this is difficult, consider an assessment. It is also important to assess facial asymmetry in newborns, as this can be associated with torticollis and tightness of the jaw and cheek muscles as well, which will have a significant impact on a baby's ability to achieve a proper latch for breastfeeding. We also know from Chapter 1 that facial asymmetry is associated with plagiocephaly. In newborns, it is particularly important to pay attention to the jawline and the mouth. We can often see asymmetry best when a baby is crying. Note the difference in the chin angle and how wide they're able to open the mouth. Does it seem symmetrical from side to side? Do you see a difference in their gum line, such as pictured here? When the baby is calm, we can still see asymmetry in the jawline and the cheeks, which may indicate tightness of the cheek, jaw, and neck muscles, which can certainly have an impact on a baby's ability to achieve a good latch for breastfeeding. If you notice your baby having any difficulties with breastfeeding or latching on one side, or they're consistently wanting to turn in one direction or tilting to one side, please ensure that you have them assessed by an infant physiotherapist in your area as soon as possible so that you can be taught the necessary stretches and range of motion exercises to help your baby achieve full range of motion as fast as possible. In the Calgary, Alberta region, infant physiotherapy and breastfeeding assessments are available at Milestones Physical Therapy Services. Lakevien Physiotherapy and Acupuncture also offers infant physiotherapy and breastfeeding assessments. Calgary Youth Physiotherapy has a number of therapists trained in infant physiotherapy assessments. And Vita Health and Wellness also offers breastfeeding assessment and support and infant physiotherapy. Due to COVID-19, all of these providers are currently offering virtual therapy assessment and treatment via telehealth. Thank you for watching today, and please join me for Chapter 3, where we discuss counterpressure strategies to use during awake time.